I'm Dr. Michael Cash. I'm a board-certified plastic surgeon at Nashville Plastic Surgery, and I thought we might take a minute to talk about an abdominoplasty or a tummy tuck. Most people are familiar with this operation, but I thought I might give you some details. An abdominoplasty is an operation where you deal with the stubborn parts of the belly. As someone ages or life goes on, there are certain things that change the appearance of the belly or the abdomen. That may be weight gain and loss. It may be a woman having children, or it may just be life. There are a few things that go into an abdominoplasty, and that's obviously going to be individually tailored to you, but let's talk about some of those things that may be included. The fat deposits in the abdomen sometimes can be addressed with liposuction, and then sometimes, in order to get the best outcome, we really need to do a full abdominoplasty. An abdominoplasty includes cutting out the skin and the belly fat below the belly button, and then bringing those six-pack muscles back together. When they splay apart, you can also often get a bulge in the center of the upper abdomen that only really is corrected by bringing those six-pack muscles back together. The medical name for this is called diastasis recti. And those are brought back together with a permanent suture. And what that does is it allows the middle of the abdomen to be flat, but also to improve the contour laterally. And then additionally, by removing the skin and the belly fat below the belly button, we're able to bring down the skin and make that skin tighter. So often women will have stretch marks below their belly button, and those will go away. Anything above the belly button typically has to stay. It's an operation that women are thrilled with because all of a sudden, then they feel comfortable in a bikini again or in this dress because their belly's flat. Let's talk a little bit about the recovery of a tummy tuck. The incision is hip to hip. There's also an incision all the way around the belly button. The patient should expect that you'll have 2 drains, typically that last maybe 2 to 3 weeks. There are ways to do the tummy tuck with no drains or with fewer drains, but it has to be the right patient. The recovery, you'll expect to go home the same day. You'll have steri-strips over your incisions. You'll wear foam and then an abdominal binder for several weeks. You'll shower 2 days later. The drains, as I said, maybe last 2 to 3 weeks. We'll see you back in the office for several weeks in a row just to make sure everything is looking nice and healing well. This operation, most people take somewhere between 2 to 4 weeks off of work, and they're able to get back to their life a little bit quicker than most people anticipate. We've found that this is an operation that people recover from very well, and that the perception of what the recovery will be like is much worse than it actually is. So we hope to be able to discuss any of your concerns and see how we might help with your journey.